holding a rally here in Whitehall this afternoon, just outside Downing Street. Obviously, we're in the first day of a 4-day doctors' strike. They are asking, of course, for 35%. I'm joined now by Dr Tal Ellenbogen. He is in his 4th year of surgical training in Nottingham. Tal, thank you very much for talking to us. The government have offered 8.8% as an average, and they say that's a fair and final offer. What do you make of that?
Well, 8.8% is less than the rate of inflation for the past year at 11%. So it's another real terms pay cut imposed on us on top of 14 years of real terms pay cuts. What's happened here is that we've been stolen off £6 an hour. Steve Barclay and Rishi Sunak are offering us £1.40. If a burglar took £6 off you and gave you £1.40 back, is it unreasonable to ask for the rest back? And also, is it realistic to expect the NHS to run on the goodwill of doctors who are taking a pay cut year on year on year, until doctors now are starting on not much above minimum wage, or with 100 grand of debt to repay from medical school?
It's cost the NHS already about £1 billion, and nurses have settled for a lot less, as of course have teachers. Why do doctors think they're worth so much more in terms of the pay rise you're looking for?
So it has cost the NHS over £1 billion, which is money the government are paying to sustain these strikes. All we're asking for with that £6 an hour increase is £1 billion a year. They could have already paid it. So it shows it's not about affordability, it's purely about ideology. Now, as for nurses and teachers, I can't speak for them, and they have the right to decide how they approach their pay. But it's very clear, you can see from an article in the Financial Times, that doctors have had the biggest pay cuts of any public sector workers. The Financial Times, using CPI and a different methodology, found that the average worker in the UK is down 3.5% on their pay in real terms. Nurses are down 13%, teachers slightly more, doctors 24%. So we've had our pay eroded by 8 times the average worker. So while everyone is struggling with the cost of living crisis, and I empathise with every single viewer out there who's struggling, it's clear that these pay cuts are driving doctors to leave the NHS, meaning all of us can't get the treatment that we want.
We do have a national debt of £2.6 trillion. The government say they're very worried about pay rises just fueling inflation. Do you have any sympathy with that view at all?
I think it's an excuse, to be fair. What happens here in terms of affordability, they talk about 2.6 trillion in debt. We're asking for 1 billion. It's a drop in the ocean. Now, we have to talk about, can this country afford not to pay doctors? We have got 2.6 million people off work due to illness, 7.6 on the waiting list. We've had a conclusion from the Financial Times that it's costing the economy £16 billion a year. If the government likes supply-side policies, surely investing in the healthcare of the nation by keeping doctors here and restoring our pay is the best supply-side policy out there. As for inflation, it's a completely ridiculous argument. Economists at the London School of Economics, in Bloomberg, all over have debunked the argument that public sector pay rises contribute to inflation. How can you have cost-push inflation when we haven't got a product to sell? If you see us and we're paid £20 an hour, we'll charge you nothing, just like we charge you nothing when we're paid £14 an hour.
Thank you very much for talking to us. So as you can see there, the doctors feel very strongly that they deserve a much bigger pay rise than the government is currently offering. They're due to ballot for a new mandate for 6 months at the end of this month. They feel confident they will get that, so it's looking like these strikes could continue well into next year.
Look, Katherine, I'm really sorry to do this. I hate doing interviews this way because it's very, very clunky, but I don't know if that chap is still there. But I just want, if possible, just for you to ask him, the co-chair of the Junior Doctors Committee of the BMA today, speaking to the BBC, said the reason that they'd accepted the exact same pay deal in Scotland was because there's a different government in Scotland. So it is just about politics, not about money, isn't it? Doesn't he just hate the Tories?
So the presenter is saying that a similar deal has been accepted in Scotland, and the co-chair of the BMA this morning was basically saying it's because it's a different government. Is some of this the fact that lots of doctors just really don't like the Conservatives?
I'm not here to support Labour or the Conservatives. I am not displaying any political views. The difference between us and the Scottish Government is, one, they have acknowledged the massive pay cuts that doctors have faced. Two, they've offered 12.4%, not 8.8%. Three, they have promised a minimum of inflation and additional pay rises to work to restore pay over the next few years. This government haven't even acknowledged us. The Prime Minister has said there's no more negotiations before he's ever stepped into the room. I think he's just burying his head in the sand until he gets voted out at the next election. In my opinion, that's cowardly.